Hello. So in today's Ask Allison, we're going to get slightly clinical, but I've decided to get clinical, which I normally try to veer away from, because I think that this is a circumstance in which it leaks into our practices. And I'm curious if the person who wrote me this, they might have been in practice for a long time in an agency, but everything just feels a little bit different when you're in private practice, like you question your therapy, everything. So, so I'm going to answer this a little bit clinically with the asterisk and caveat that you might have a totally different theoretical orientation than I do. And so take it with a grain of salt. If it fits, it fits. If it doesn't, it doesn't. So the question is, and first I'll say thanks to TherapyNotes for sponsoring us. Question is, I have a problem starting sessions. When I ask, how are you doing? I often get a long answer when I would prefer to just start the session. Do I start with where we left off last session or with what they want to discuss for the session? What is one solid way to wrap up sessions when a patient starts crying and I have other people waiting? So I definitely hear the anxiety in the last part of that, right? Because I'm somebody who, when I'm late, I get highly anxious. And the idea of someone waiting on me and feeling responsible for the person in the room, it just feels messy and hard. So let's start with the first part, the starting the session. When you say, how are you doing? You have started the session for this client, right? Or for these clients. They likely think like, okay, therapy has started. Because it might be that they're reporting what's gone on since last session. It might mean they're talking about something that happened today that bothered them. So if you have a more structured approach, what I would do is I would consider their treatment goals and how that might relate to what they're saying and tie it in that way. Or I might start out more structured and say, last time we talked a lot about topic. Like, how did you feel after that conversation? Has anything felt different? Has anything changed? Or last time we talked about you having a really difficult conversation with this person in your life. How did that go? So if you're wanting to come from a more structured place or wanting to start therapy in a different way, that might be a way to do it. With regards to ending the session, one thing that I tell clients is that it is my responsibility as a therapist to manage the time. And so I've got clocks facing both of us. I have a little buzzer on my watch that's nobody can hear, it just vibrates. So I do my best to make sure I am not poking things that I know are going to be very vulnerable there at the end of session. Now, sometimes we just walk right into it and we didn't know it was there and there's nothing we can do about that. So in those circumstances, what I might do is say something like, I know you probably have somewhere you need to be in the near future, and I'm clear that there's a lot more work to do around this topic. Can we take a few minutes to do some grounding exercises? And are you willing to talk about this some more next time we meet? And that way it's coming from this place of, I want you to be able to go out into the world not feeling like you've been torn apart. And also, it's not a hurrying along, but it's like, let's get grounded. We are going to discuss this more. This is going to be something that is a part of your treatment or a part of your therapy. So it doesn't brush whatever is upsetting aside either. It doesn't brush the person or the topic aside. So, and then that segues back into starting, right? So next time you could say, we had started talking about this hard thing last session. Can we dive more into that now? So a little bit more clinical than I usually go here. Again, take it or leave it if it is not your theoretical orientation or if it's not aligned with your theoretical orientation. But hopefully that's helpful. I think about these as kind of like the starting and stopping is sometimes some boundary issues in our practice of not boundary like anybody's going beyond boundaries, but just in terms of having more of what you want. And it sounds like this person's ready to roll up their sleeves in a different way at the start and wants to be considerate and thoughtful about how they end without feeling like they're messing up on boundaries, making other people wait. So yeah, I hope that's helpful. I'll talk with y'all soon.